Okay, go.
Okay, so I'm Amanda. I'm a student midwife with Midwives College of Utah. It's a distance program. And so for one of my communications classes, I'm doing this presentation, and I'm doing it on chiropractic care in pregnancy. So it's one of, in my opinion, the most important things throughout your pregnancy. And
Might want to talk a little louder.
okay. So there's several factors in pregnancy that would make you want to consider seeing a chiropractor. Obviously there's the weight gain and the change in your center of gravity, but in addition to that, there's higher demand and fatigue on your spinal and pelvic muscles and increased stress on the spinal and pelvic ligaments as well. So I'm gonna, you might already know what this term is, but subluxation is when there's a misalignment in either your sacrum or your this is the ilium. So it's when there's a misalignment in these bones because things tend to shift and move when you're pregnant. So I'm going to be talking about subluxations a lot. So just want to make sure you know what I'm talking about. So frequent vertebral and sacroiliac, which is right here, this joint right here, the sacroiliac joint, which connects to the sacrum. So frequent vertebral and sacroiliac joint subluxations can lead to debilitating back muscle or nerve pain, which hopefully you haven't experienced any of that since you've been seeing a chiropractor. Obviously it can lead to sedentary lifestyle, not wanting to exercise, be active, things like that, which you really want to do when you're pregnant. Next one. So there was a study done among pregnant people, women, I could say now. And out of those pregnant women, 61% of them were experiencing back pain related to their pregnancy. 75% of them hadn't experienced any prior to pregnancy. And oftentimes it can lead to other ailments such as nerve and ligament pain, which can lead to sciatica pain, which is really common, and another one called SPD, which is symphysis pubis dysfunction. This is the symphysis pubis joint right here. So when that pain is when like basically these two bones are grinding on each other and makes getting out of bed and out of the car really painful. I've experienced it. Not fun.
Is that caused by the pressure of the baby?
It is caused by
Oh, sorry.
No, you're perfect. So
there it is.
Little background, yes. Relaxin is a protein-based hormone in the insulin superfamily. It's produced in females in the ovaries, but when you're pregnant, it's produced by the placenta as well. And so when you're pregnant, you produce 10 times more of it than when you're not pregnant. And its job is to soften things. So it softens your cervix and your sacral joints and your pubic symphysis, which we just talked about. And so all that softening is a really good thing, but it can also lead to subluxations, which we just mentioned. Because things are moving and shifting and it's easier for things to get out of alignment. So it can create an imbalance in the surrounding muscles and ligaments, causing structural issues that can lead to other ailments, like I just talked about. So subluxations in the spine can cause swelling and inflammation in the spinal joints, which puts pressure on the spinal nerve roots as they move from the spinal cord right here down to the down to the pelvic basin, and that's known as sciatica pain. And you can stop.
Okay.
If you